Hello. Hey guys. Well, today is April 10th of I think today's April 10th. I think it's April 10th of 2022. And I'm Cory Hunt, 31 years old. Obviously I'm a male, and this is my health diary. You guys are probably noticing excuse me, that I look like shit today, and throughout this video you're probably going to notice my low energy and probably not so bright spirit, and that is because I don't have too much to be happy about right now. For those of you who might be new to this specific channel and new to my videos, I am kind of dealing with an issue. I truly believe that I might possibly have inflammatory breast cancer, and I have yet to be diagnosed, so this is just my opinion. But in my defense, I have not received the tests that are needed to properly diagnose this issue. I have received multiple ultrasounds, and I did one mammogram on April 1st of 2022. However, for those of you who are not educated about inflammatory breast cancer, somewhat, those are not the tests that would normally confirm that specific type of breast cancer. The number one test needed to diagnose inflammatory breast cancer is a biopsy. And even in that biopsy, from what I've researched, it is in a person's best interest that when they do the biopsy, maybe they take more than one sample. So just to kind of inform you guys on why I'm not feeling so great, and this is a video that is supposed to inform you guys post my appointment with the breast specialist in Wichita Falls, Texas. It's supposed to inform you guys like how it went and what happened. So I'm just going to be very straightforward with you guys. It did not go well, and I will explain why. So again, I live in Wichita Falls, Texas, which is a smaller city that is very north, center north of the state of Texas. I'm about 2 hours away from Fort Worth or Dallas. Fort Worth and Dallas is a little bit more southeast from where I currently live. And it's a smaller city compared to the bigger cities such as Fort Worth, Dallas, or Houston or Austin. So in this small city, I saw my new physician. His name is Dr. Andrew Panda. He's my new primary. And once I went to go see him, he referred me to a breast specialist, right? So I'm going to give you guys all this information on the breast specialist because I want everyone to be aware of basically the negligence that this doctor showed me. So her name is Dr. Beth H. Sutton, MD. Her office is located on 1600, what was it? God, I can't remember what it was. I think it was 1600 Brook Drive. It's in Wichita Falls, Texas, and the zip code was 76301. I will get back to you guys on the address that she is at, but so I went and seen her, and mind you, when I'm going there, I'm very concerned. I'm scared because, again, once you start going to these appointments, it's like the reality that this is a real situation and you're the one who's really experiencing it and so forth. It's scary, man. It's really scary. And not to mention, I'm scared because I read all these I read or I watch these videos where all of these women, they basically get dismissed. They get told that, oh, you're fine. Oh, it's just a rash. Oh, it's a sunburn. You're fine. You know, and they go these long periods of times without being diagnosed. So I'm afraid of that. And I'm really hopeful though. I'm going into the appointment and I'm hopeful that I'm going to get answers, that she's going to listen to me and so forth. So I get to the appointment, and I thought the appointment was at 9:30. Apparently the woman said that it was at 9, but nonetheless they were still willing to see me, which I appreciated. So fast forward, I go into the office. Ultimately, Dr. Beth Sutton comes into the room, and she kind of instantly consoles me. She puts her arm around my shoulder, and she says, "Hey, everything's gonna be okay, okay?" And that made me feel good. I felt like, okay, she's genuinely concerned about how I feel, because you could immediately tell that my demeanor was afraid. And I can't remember, but I think I might have started to kind of get a little teary-eyed and stuff, because again, it's just like, wow, man, like this is really happening. Like I'm really seeing a breast specialist right now because I might have cancer. So, so she's kind of talking with me, and she goes, she asked me, she said, so what brings you here? What's going on? Why do you feel, that you're having this concern? So I tell her the same thing I'm telling you guys. I tell her about my symptoms. I have this swollen area on the right side of my breast, underneath my armpit. My lymph nodes are clearly enlarged. I'm not perspirating there. I feel burning and itching that comes and goes. I just know that something is wrong. This is not normal. My body is telling me something is wrong. My instincts are telling me something that is wrong. Please help me, please. I told her that, at first I believed that maybe it was an infection or something else was going on, but when the antibiotics didn't help and it just kind of seems to be getting worse, I'm just kind of like, I did some research. I came across inflammatory breast cancer. The symptoms seem to be lining up with what I'm experiencing, and I just want to rule it out. I feel, and of course, like I always say, I do not want to have inflammatory breast cancer. I don't want to have any form of breast cancer. I don't want to self-diagnose myself with something so terribly. I want it to be an infection that I can take pills for and it go away, or just anything very minor. But at the same time, wanting that and it being that are two different things. Eventually you have to come to terms with, this is something serious and I need to diagnose it and start treatment for it right away if I'm going to have the best outcome, right? So I tell her all of this. I tell her about around the age that I first noticed that I was having swelling under there, which I've already told you guys in a separate video. I noticed the swelling between the ages of 23 to 25. Now, I'm not saying, guys, I am not saying that I feel that my inflammatory breast cancer started between the ages of 23 and 25. No, not saying that. Never did say that. I'm saying that after I cut myself shaving, and then I used an antiperspirant right away because I had to go to work. From that point on is when I noticed that my lymph nodes underneath the same armpit have always been bothered and enlarged. Okay? And that's the same thing I told her. I told her that I went and seen my physician in Arizona about it. He did an ultrasound, said everything looks good, told me to forget about it. I did. Fast forward 3 to 4 years later, when I was in Omaha, Nebraska, I continued to notice that the lymph nodes were enlarged and that, the area was enlarged. I wasn't experiencing, burning or itching or anything like that at the time, and there was no lump on the side of my breast, so I was like, okay, well, I saw my doctor out there in Omaha, Nebraska. He did the same test, an ultrasound. Everything came back fine, said everything was fine. Don't worry about it. And that's what I did. Fast forward another 3 to 4 years. I move out here to Wichita Falls. February 20th, I noticed the lump now on my breast. I noticed that the lymph nodes are still enlarged. And now I also notice that it's not perspirating. And then I notice like that my lymph nodes, I feel like an aching pain that comes and goes in my lymph nodes. And then I start to feel burning and itching. And I'm like, okay, what's going on here? And ultimately, now I'm here in your office, Dr. Beth Sutton. I'm here. This has obviously progressively gotten worse over a long period of time. I understand that. But something is seriously wrong. And now I feel like whatever is going on is progressing a little bit more rapidly than what it was before. So I'm telling her all of this. And I tell her a few other things that she asked me about, and I answer honestly. So ultimately, what she ends up doing is I take off my shirt. She does a physical, she has me lay back and lay down. She brings me up on the table. She does a physical exam of that area, meaning she puts her gloves on and she's pressing on it. She's feeling it, all of that stuff, right? Then she says, hey, we're going to do an ultrasound. She puts the gel on me. She does the ultrasound of the lymph area. She does it of the breast area. And, you know, we wipe it off. She tells me, hey, I'm going to step out for a little bit. You go ahead and put your shirt on. I'll come back in and we'll talk. I say, okay, great. Put my shirt on. She comes back in and she says, so I got good news. You don't have any cancer. You don't have an infection. You're fine. You're great, right? So one would think, well, wait, that's great news, dude. You're fine. You're great. You don't have cancer, right? I feel for her to say that was, how do I put it? It's premature, and there's not solid proof to confirm that. All the tests that I have gotten done so far is a physical exam or a doctor or physician physically looking at it, an ultrasound, multiple, and a mammogram. Okay? Now, if you research inflammatory breast cancer, and if you watch videos of women who have eventually been diagnosed with this, they will tell you that they as well got physical exams and ultrasounds and mammograms. And they were told the same thing that I was just told by that breast specialist on Friday, April 7th of 2022. They told them, hey, your mammogram looks great. It's fine. You're normal. Hey, your ultrasounds look great. It's fine. It's normal. You're good. I know you're having physical symptoms that are making you uncomfortable, but hey, you don't have cancer, right? And they're telling them, okay, I mean, that sounds great, but doc, I'm hurting over here. I'm in pain. Something don't feel right. You know, okay, if you're telling me that, can we continue to investigate what's going on? Because, I mean, that sounds great that I don't have anything super serious, but I'm uncomfortable here. And doctors tell them, oh, you know, yeah, I'm sorry you're uncomfortable, but here goes some antibiotics. Should clear up in a couple of weeks, maybe a month or two. Or, yeah, it's just a sunburn, or it's just a rash. It should clear up in a month or two or a couple of weeks. But then it progressively gets worse. And then once it's so bad the rash has become so painful and so widespread, and it's just so clear that something serious is going on, is when these women stated they finally got a biopsy, where within the biopsy they got multiple samples taken, and maybe also they got an MRI or a PET scan, because apparently with inflammatory breast cancer, if you get an MRI or even a PET scan, it'll show up as a lesion. Because remember, with inflammatory breast cancer, it's not like traditional breast cancer. There will be no lumps in a sense of there's a tumor, like a ball tumor, or it's not like that, man. It doesn't grow like that. And but once they finally got a biopsy and an MRI or a PET scan, but ultimately a biopsy is absolutely what you need. They said that they were told, yeah, I'm sorry to tell you this, but you have inflammatory breast cancer, one of the most rare and aggressive forms of it that is highly fatal. Sorry you came to us 4 months ago when it was probably, and most of these women who got this, they got diagnosed with stage 3 or stage 4. But 4 months ago, it was probably in stage 2. Sorry, we made your chances of surviving it even less now, because we didn't believe that it was anything serious, because we treated your situation like we were looking for traditional breast cancer. And that's how I feel with this Dr. Beth H. Sutton, located in Wichita Falls, Texas, who is a breast surgeon and a breast specialist. When she told me, I got good news for you, you don't have cancer and you don't have an infection, I'm like, okay, but we haven't done a biopsy. So how? And she's, oh, well, and she didn't use the term inflammatory breast cancer. She kept using the term inflammatory carcinoma. Now, I don't know if those are the same thing. I don't know. But it made me wonder, like, her using that term made me wonder, okay, and I'm just thinking this in my head because I don't want to be rude to her. Remember, I'm looking for this woman to help me. So I'm not looking to offend her in any way. I just want help. And I don't want to ruin those chances by asking her a question that would be like, excuse you? But I started thinking in my head when she said inflammatory carcinoma, I'm like, has she ever even seen real life inflammatory breast cancer? Has she ever felt it, seen it? Has she ever performed a biopsy on it to collect a sample? Has she ever treated it in a sense of, has she ever performed a mastectomy for it or given a person chemotherapy for it? Has she ever successfully treated someone with inflammatory breast cancer, as in she diagnosed them, she treated them, and they're still surviving and thriving? So does she really even know what it is that I'm here for? And I don't know. I didn't ask her because, again, I didn't want to offend her. But so our appointment continues, and I'm saying, okay, but I got this lump on the side of my breast, though. Like, this breast looks different from this breast because there's a bulge here. But I'm having burning and itching sensation that comes and goes. And I get this aching pain in here, and sometimes it makes my arm hurt, or, that part of my breast will hurt. But I'm not perspirating right there, and it's swollen. How do you explain that? Like, so if you're saying that it's not cancer, inflammatory breast cancer, and it's not an infection, then what is it? And you know what her answer for that was? Well, I don't know, but it's not that. I don't know what's going on. She said, maybe you were born with that. Maybe you were born where you don't perspirate right there. And I said, no, I was. I said, I remember when I was younger and I would play sports and I would get sweaty. It would sweat. So I also want to show you guys, I have tattoos, right? All over. I have tattoos all over. And here I have a blackout sleeve that I had to do myself, because when I went to a tattoo shop and I asked them, I said, hey, I want a blackout sleeve. How much would you guys charge me? They said, oh, we'll charge you $2,000. Well, guys, I'm poor. I've been poor all my life. I do not have $2,000 that I can go and spend on getting a blackout sleeve done. So I said, okay, I'm not satisfied with the tattoos that I want to cover up, but I want this blackout sleeve, so I'm gonna do it myself. So I did research. I found out how to properly sanitize an area before you tattoo it, how to continue to sanitize it and keep it clean, how to practice tattooing with a tattoo gun and needles and so forth, what ink to buy and all that. I tried to be as informed as I can. I bought all the material myself from Amazon and I tattooed my whole arm myself. It took me about a year to finally get the whole arm covered and saturated enough to where you couldn't see the tattoos underneath it, right? So she asked me about, prior to us ultimately getting to this point to where she's trying to explain why, this area is having the symptoms that it's having. I told her about that. I said, yeah, I tattooed this myself, but as you can see, I have other tattoos, So she continues to try to explain why I'm having these symptoms, but it's nothing serious, by taking all the information that she was asking me for on my tattoos and my prior history with, this area and so forth. And she starts to use these as an excuse as to why I'm experiencing these symptoms. And she says, oh, well, maybe your lymph nodes and that area that's not perspirating and it's swollen, I think that's your body reacting to all the tattoos that you have, especially your blackout sleeve. When you get tattoos, you develop scar tissue, and this aggravates your lymph nodes, and it could aggravate these parts of your body, and that's probably what's going on. So first it was, oh, I was probably born with this inability to perspirate in this area, and then my tattoos are probably what's causing what's going on there. Now, then I also told her, when I saw my doctor in Omaha, Nebraska, I told her that I asked him the same thing, kind of like after we did the ultrasound and he said everything came back normal. I asked him, I said, well, doc, if it's normal, then why is it swollen here, but it's fine here? Like, what's going on? Like, can you give me an explanation? And I told her that his explanation to me was, oh, well, the body's not asymmetrical or symmetrical. One side of the body can look different than the other side of the body, and you could be perfectly benign. You could be perfectly fine. And she, and I told her I was puzzled by that because, I understand that there are certain parts of the body that can look a little differently, but this is just not one of those. This is something different. But she took that excuse as well, and she ran with that. She said, and I agree with that doctor in Omaha, Nebraska. I agree that you just have an anatomy issue here where one part of your body isn't as symmetrical as the other, but it's totally benign. I agree with him. So it went from, you were born with this inability to perspirate, which wasn't true, to, oh, I think your tattoos are what's causing your issue there. So that's probably why your body is reacting this way and you're having all these symptoms, to, oh yeah, I think, once again, you might have just been born with this anatomy issue, and that's why this part of your body isn't as symmetrical as this. She literally took all of these answers, except for the tattooing. I mean, that was just an observation that she made and used as an excuse, but she took these other answers I gave her as an excuse to try to explain why I'm having my symptoms. And I'm like, okay, well, and mind you, I'm being polite and respectful this whole time through, right? And I'm telling her, okay, I understand and I hear you, but I am still concerned. And I kept bringing up, hey, I would like to do a biopsy. I understand you're saying that I'm cancer free. I don't have that issue, and that makes me feel good, but I really want to be safer than sorry. Can we do a biopsy, please? And I begged her 3 times. I think at least three. At least 3 times I begged her, can we please do a biopsy? That would give me so much peace of mind. If we do a biopsy and it comes back and it says I don't have it, then I think I would feel a lot better. I really would. Now, that doesn't mean I'm not going to continue to pursue to figure out what's going on down here, but that would make me feel a lot better about, like, hey, maybe it's not inflammatory. I mean, they did a biopsy, you know, but she goes, no, I don't think you need that. And then she further goes on by saying, if we do a biopsy, it's going to give you these side effects that I just really don't want you to go through. And I said, well, what side effects are these? I mean, she's making it sound horrific. She's making it sound like I'm going to be disfigured and I'm going to go through so much pain if I get this biopsy. So I ask her, I say, well, Beth, Dr. Beth H. Sutton, what are these side effects? Because I'm pretty scared of inflammatory breast cancer, and I would like to get a biopsy to rule that out. And you're making it seem like, I'm thinking this in my head, you're making it seem like a biopsy is worse. What's the deal here? And, oh, well, if we do a biopsy, what I'm going to do is I'm going to take a needle and I'm going to take tissue from that area, whatever area we point out that we think it might be in. And then when I do that, you can get swelling, you can get redness, it could hurt, it could just make that area look and feel worse. And I don't want to put you through that. And I respond to her and I say, look, I'm okay with that. I'm fine with that. If that's something I have to go through to confirm or deny that this is or is not inflammatory breast cancer, I'm okay with that. I'm a big boy. I can handle a little bit of pain. And then she's like, well, I don't want you to freak out about the side effects. I feel like the side effects will make you feel like it's getting worse or you do have it. And I said, well, no, if you do it and you say, hey, I want you to look out for these side effects of swelling or redness or whatever, because those are common side effects of a biopsy. So if you see them, don't freak out. Just wait for your results and, everything will be okay. So if you tell me, hey, if we perform this biopsy, it's common for you to have side effects of the area to kind of swell, get red and irritated, maybe you'll get a bruise, that's okay. So if you see that, that's okay. I would be like, okay, I see that going on. She told me that's a common symptom. I'm okay. I'm not going to rush to the hospital. Now, if you tell me, hey, if we perform this biopsy, you might get some redness, some swelling, maybe some bruising, but hey, a not common side effect of a biopsy is if your chest starts to hurt and you get a sharp stabbing pain that lasts for 20 minutes. If you experience that, that's not common. Go to the ER. Then I'm going to freak out and say, oh, wow, yeah, let me go seek treatment. It's just basic communication between a doctor who cares and their patient. Hey, we're going to perform this procedure for you because we need to make sure that this isn't something serious, but I'm going to be a good doctor and let you know what the common side effects of this are. It might be uncomfortable, but I agree with you. Let's be safer than sorry. But no. She said, I've been a surgeon for a very long time and I don't think this is inflammatory carcinoma. Once again, using that term, not the term inflammatory breast cancer. So for one, I don't even know if we're talking about the same disease. But she's basically telling me, oh, I've been around the block for a while and this just doesn't look like that to me. And if another thing that's going on in my head is, I've never known from the research that I've done and the videos that I've watched, I have yet to come across a video where a person was diagnosed, confirmed by a doctor's opinion. Last I checked, they were diagnosed by a biopsy. But that's not the end of it, right? That's not the end of it. This appointment lasted about, I think, about 45 minutes or so. So again, remember, she's telling me all these things, but I ask her multiple times, Beth, I know you're telling me this, but please, I just really want a biopsy. Please, please. So then she goes on to say, you know what I really think it is? I just really think that your anxiety and your depression is so bad that it's causing you to think that this is what you have. I really think that you should go back to your primary, who is Dr. Andrew Panda at United Regional Family Clinic, and you should really talk to him about maybe getting you to see a therapist and maybe putting you on some medication for anxiety and depression. But I told her, I said, well, Beth, I don't really suffer from anxiety and depression like that. I said, prior to me discovering this about February 20th, I was doing very well and I was very happy. I had just started a YouTube channel called anime_44_love, where I had already started and I was going to continue making videos that I really enjoyed, which were movie reviews, because I'm a huge movie buff. I love movies. I think that theater and movies is so artistic, and I'm a very artistic person. I enjoy movies so much. And I wanted to share that passion with the world by doing movie reviews. So if a person, was like, man, I wonder if the movie The Tourist with Johnny Depp is good, I wanted to put a movie review out there that somebody can see and they could see and hear my review and say, oh man, this guy makes that movie sound really good. Let me watch it. And then when they watch it, they could be like, man, that dude was right. This movie is good. I wanted to share that with people. I'm also an artist myself, physically. I draw, and I've painted once. And I don't mean to toot my own horn, but I'm a really good artist. I can draw really good. I draw portraits. I drew a portrait of myself. I drew a portrait of my wife. I've drawn a portrait of I've drawn a lot of different things, and they're really good. And I'll show you guys here soon enough. I painted. As you can tell from my the YouTube channel name, I love anime. And I had watched a movie called My Hero Academia Heroes Rising, and it was so good and it was so inspirational that I drew a scene from the movie and it came out so freaking good. And what I planned on doing for that YouTube channel is I wanted to draw and paint as well, but I wanted to record myself drawing and painting so I can upload it to YouTube so people could see the process. They could see the beginning and the end, and I can gain viewers and subscribers from that, as well as my movie reviews. So I was super excited about that. Not only could I get subscribers and viewers from that, but I could also sell my drawings and paintings. And then I think lastly, I wanted to I also wanted to do reaction videos to like anime episodes or TV show episodes like Yellowstone, or I don't know, Justified, or other shows that I really enjoyed, right? So I was super excited, and my plan is I was working at Target at this time, and my plan was I was working 5 days a week to support my household, right? It's me, my wife, and our 2 daughters who are 6 and 7 years old. And what my goal was is, I couldn't completely quit my job because I had to still pay bills. But I said, I think if I only work up to, at the very least, 3 days a week, I can still support my bills, but I have more time and energy to do YouTube and do these drawings and paintings and record my videos for the movie reviews, but edit them, because I put a lot of pictures and video clips in my movie reviews, because I noticed through personal experience that people are very visual, and I feel like they respond a lot better to your videos when you have a lot of pictures and so forth in there. So my goal was to gradually go down in the number of days that I work, which I had started doing that. I emailed my boss at Target and I said, "Hey, instead of 5 days a week, can you take me down to 4 days a week?" He had did that. But then he kind of gradually brought me back up to 5 because, I was a very reliable worker and I think they just liked having me there, which I appreciate. But, I had my goal. So I was going to talk to him again once I did more videos and gained more viewers and subscribers. I was going to say, "Hey, let's take me back down to 4. In fact, in a little bit, I'm going to need you to take me back. I'm going to need you to take me down to 3." And then that's when I was going to really get going. But then again, so again, I was very happy. I was excited. I was eager. Like, man, I'm going to become a YouTuber. And hopefully I become a famous YouTuber and I start making a lot of money from YouTube. And eventually, hopefully I could stop working altogether and being a YouTuber can be my full-time job like other YouTubers out there, such as Mastar Media or Cory Kenshin or, just a ton of other people, That was my goal. That is what was going to make me happy and I was excited to do it. So I wasn't anxious. I wasn't depressed. I was happy. But then when I noticed this, and I felt like, whoa, something is seriously wrong here, that's when I became anxious and depressed because I'm like, dude, this looks like something serious. And then when I started doing my research, because I was growing concerned about this, and I'm like, something's wrong here, that's when it kicked in. I am not naturally an anxious and depressing person. And anyone who truly knows me can verify that. So for this, Dr. Beth H. Sutton in Wichita Falls, Texas, this breast surgeon / specialist who's telling me, "You know what, you're fine. I just think you suffer from anxiety and depression." I was offended by that. And that is not the truth. That's not what's going on here. I'm anxious and depressed because I can sense and feel that there is something seriously wrong. And it could be something highly fatal. So she offends me by saying that, and mind you, she's only met me this one time, and we didn't even interact for a full hour, and yet she's already assessed me in a sense of she knows that I'm a very anxious and depressing person. But you don't even know me. You've known me for 40 minutes. And then lastly, I want to say the last and final thing that I was offended by, and I definitely knew that I was getting nowhere with her, was I told her, because she again, she's trying to console me. She's trying to get me to think that this is nothing. And she tells me, she says, "You know what the best thing to do with this is? Just forget about it." Where people go wrong is they go back home and they just look at it and they touch it and they feel it. And you just don't need to do that. You just need to take it out of your mind. Really? So when it burns and it itches, I just need to ignore it? I just need to take it out of my mind? When it aches, when it makes my arm hurt, the solution for that is just don't think about it. I was very offended by that because I'm not an idiot. And that's not how you treat something. And then she also, so with her saying that, I say, well, what my plan was is if I verified that this wasn't anything serious and I get the clear and the go ahead that, hey, we've confirmed through biopsies and every other test, that I'm afforded, that this is not anything serious. If I can believe that, what I was going to plan to do is I was going to work my tail off, come up with enough money, and I wanted to go and see a cosmetic surgeon about maybe getting liposuction done for my armpit, to get rid of whatever's going on down there. But that was only after I confirmed that it's not anything serious like an infection or cancer, because obviously you don't want somebody to go in there and make it worse, right? So then she goes on to say, and again, this is kind of related to just leave it alone. Just don't even think about it, even though it's cosmetically, wrong, and even though it causes you pain, don't worry about it. She also goes on to say, after I say that, about the getting it cosmetically removed, if I could afford it, she goes on to say, I think you just need to leave your body alone. I just think and she's kind of bringing up my tattoos as well, almost as to say, like, yeah, you're not looking too good with the decisions that you're making. It's probably best if you just leave your body alone. And mind you, she's older, and I know that a lot of the older generation isn't too crazy about tattoos and other things of that nature. But I just kind of get that feeling like at that point she was kind of saying that she wasn't a big fan of my tattoos and that maybe they looked bad, and in her opinion I should probably stop trying to I guess improve myself cosmetically. So I was kind of offended by that too. But ultimately I asked her, I said, so Beth, are you saying we're not going to do a biopsy? No, in my opinion, you don't need it. This is not inflammatory carcinoma. Again, using that term. And I know the term IBC, or inflammatory breast cancer. I don't know inflammatory carcinoma. It could be the same thing, but I don't know if that is what it is. And again, I don't know if she's ever even seen or treated inflammatory breast cancer, or even diagnosed a person with it. So I don't even know if she really knows what she's supposed to be looking for. So it didn't go well, man. She said what she was going to do. This is at the end of my appointment. She said what she was going to do was she was going to communicate with my doctor, Andrew Panda, and she was going to let him know that she believes that I need to be on anxiety and depression pills. And she said, how about this? How about, you take your anxiety and depression pills if he prescribes them to you for a while. And, if after you're on those medications for a while, if you're still feeling like there's something wrong, maybe we'll do the biopsy then. And I'm like, what? Why? What's the difference? And plus, I just explained to you that I don't suffer from anxiety and depression for no reason. I have a reason. You're not helping me address the reason. So why would I take these anxiety and depression pills? And I told her, I don't take pills. I don't like to take pills. I don't even like to take ibuprofen or Tylenol. I am not a person who likes to take pills. I like to be as pill-free as I possibly can, which I would think doctors would like and respect that, because doctors are always very cautious and wary of people who are trying to take advantage of them to get pills because they're addicts. And I'm telling you, I don't want pills. I just want this addressed. I want the biopsy to be safer than sorry. That is how inflammatory breast cancer is either confirmed or denied, through a biopsy. Nothing else. Not an ultrasound, not a mammogram. For the most part, not even really an MRI. Through a biopsy. You have the ability to do it. You can do it right now. Let's just do it. And she refused. Guys, that is one of the most frustrating things when you're with somebody who has the power and the ability to help you, but they refuse for no good reason other than you're questioning what they feel to be their superior opinion. It's like they get offended that you're just saying, hey, I respect your opinion, but hey, let's be safer than sorry. And they almost get like, what? You're questioning me? Yeah. Definitely not doing it now, since you're not respecting my opinion. And it's not that I don't respect her opinion. It's just, it's my life. It's my health. I just want to be safer than sorry. It's frustrating. And to be honest with you guys, I've teared up about it since the appointment on Friday. And I want to tear up now, but I'm just tired. I'm tired. You can hear it in my voice. My voice is raspy. I'm tired, guys. I stress about this every day, all day. I'm frustrated that I'm not getting the help. I'm running into the same issue that a lot of the women who eventually got diagnosed with this ran into. There's a woman who lives near the Houston area. Her name is I want to say her name is Terry Arnold. And she eventually went to MD Anderson, and after she was diagnosed from another oncology facility. And she's actually like a 16-year survivor or 15-year survivor. She's still alive to this day from inflammatory breast cancer, which is so inspirational and so hopeful. It really is. But she is still alive, and she ran into these same problems. She said it was a 4-month period from the time she noticed it to her actual diagnosis, and her whole breast was red and swollen. She said she felt like her breast was going to fall off because it was so painful and so swollen. And her doctors continuously performed ultrasounds and mammograms because they thought, oh, well, if it's cancer, we'll be able to see it through those tests, because they were basically uneducated and unaware of inflammatory breast cancer. And it got to the point to where they did multiple of those tests and they kept coming back normal and fine and so forth. And they kept telling her, you're fine, you're fine. There's nothing serious going on. And she, in so much pain and in fright, she kept going in there and calling them saying, something is wrong. Please keep continuing to help me find out what's going on. To the point to where she physically went into the doctor's office one day, and the receptionist there told her, ma'am, you keep calling. Everything is fine. We've done all these tests. You're fine. The doctor's not here. You don't have an appointment. And they threatened her. Terry Arnold, near the Houston area. It's a woman on YouTube who tells her story of inflammatory breast cancer and the struggle she went through just to get it diagnosed. That receptionist threatened her that if she did not leave, they were going to call security to remove her. Not too long after that, she finally was diagnosed with inflammatory breast cancer. She also stated later in her video, and maybe I'll try to insert this video somewhere in my video, but I really like to just put these videos out. Editing takes some time and so forth. Plus, since my video is really long and her video is really long, it might cause some issues with my computer. But at the end of her video, she stated that that same doctor whose office threatened to call security on her, she believed that he stopped practicing in medicine for a couple of years because he was afraid that she would sue him for basically malpractice and negligence. And she stated in her video that she had no intentions on suing him. Maybe, if anything, maybe she just wanted an apology, which, I mean, an apology would be nice, but at the same time, an apology isn't going to save somebody's life. It isn't going to bring back the heartache that they went through, that you put them through trying to get a diagnosis, the embarrassment that she probably felt when your receptionist threatened to call security on her to remove her. I feel like I'm going through, and I will probably, God forbid, but I will probably continue to go through this difficulty in getting a diagnosis. It's very frustrating, guys. But that is how my appointment went with the breast specialist on April, I think it was 7th, or it was Friday. Um, didn't go well, guys. And I still have yet to get a biopsy done. With this condition, you need to get a biopsy to confirm it. Now, I will say this, I will not stop until I get a biopsy done, because my children are worth fighting for. My life is worth fighting for. I'm 31 years old and I still have a lot of life to live. I'm not ready to die, and I have a lot to live for. I want to see my girls grow to be adults, and I'd love to see them have children, and I want to make sure that they can take care of themselves and provide for themselves and things of that nature. I don't want my wife to have to continue to raise our daughters by herself as a single mother. But it looks like it's going to be a long road ahead. But I am going to continue to seek help until I get a biopsy to either confirm or deny this. Now, I have an appointment with my physician again, Dr. Andrew Panda, because what I did was after the appointment with this breast specialist, I immediately drove to my doctor's office, Dr. Andrew Panda. I drove to his office, and I ultimately spoke with his nurse that assists him. I told her about, this appointment and how she neglected to help me. And I stated that I don't agree with her. I was offended by a lot of things that she said. She did not perform a biopsy and did not have a good reason to not perform it. And that I wanted to see another breast specialist, and I am not taking anxiety or depression pills. I have anxiety and depression for a reason, and that's okay. So they scheduled me for another appointment with them on Tuesday, which would be April 12th, I would say. And we're gonna sit down, he and I, and we're gonna maybe decide, hopefully, that I can go and see another breast specialist who can give me a second opinion and ultimately a biopsy. I'm also willing to see a radiologist, because from what I've researched, they also perform biopsies. I'm even willing to see a dermatologist if they're willing to look at this and perform a biopsy. Whoever is willing to perform a biopsy, I'm willing to see. But that's it, guys, for now. I just wanted to share, my experience with this appointment with you guys, and the fact that I was unable to get a biopsy. This is true, man. This is God forbid, but if I do have inflammatory breast cancer, this is a disease that is very difficult to get diagnosed, because doctors are very quick to dismiss it, and it's very frustrating. And if you're going through this as well, you're not alone, and I feel your pain, because I'm going through it also, and I'm a man. So, all right, guys, well, thank you for watching this video. Again, I make these videos to bring awareness to inflammatory breast cancer, because this is a horrific disease that needs to be stopped. And a way for it to be stopped is people being aware of the signs and the symptoms and getting medical assistance immediately. I also do these videos to educate people on it, and to hopefully bring people to a point to maybe they could avoid it, So, all right, guys, well, this is the end of my video. If you have any questions or concerns or any advice for me, please feel free to leave a comment in the comment box. I'd love to hear from anybody. All right, well, I'll see you guys later. Bye.